okay, this is the question they'll ask you. Number 1, what is the clinical significance of the blood supply of esophagus? Other way that this question can be framed is, what is the anatomical basis of hematemesis? Basically, hematemesis or hematemesis is known as vomiting blood. Emesis means vomiting. Hemat jo bhi means blood. So blood vomiting is what is the एनाटॉमिकल बेसिस ऑफ इट, ठीक है, ऐसे क्वेश्चन आएगा। या आपसे डायरेक्टली पूछ लेंगे ईसोफेजियल वेरिसेस का बताओ, ठीक है। तो ईसोफेजियल वेरिसेस का थोड़ा सा कॉन्सेप्ट मैं आपको बताऊंगी, आपने लिखना ये नहीं है, लेकिन ये कॉन्सेप्ट समझ लो एक दफा, ठीक है, ताकि सेकेंड ईयर में आंसू ना आए जब ये कॉन्सेप्ट जोर से आपको आना पड़ेगा। व्हाट हैपेंस इज लिवर हैज इट्स ओन सर्कुलेशन। द लिवर इज सर्कुलेटिंग, इसकी अपनी सर्कुलेशन है। लिवर की सर्कुलेशन को कहते हैं पोर्टल सर्कुलेशन। सो द ब्लड फ्रॉम द लिवर इज एंटरिंग द हार्ट। ब्लड फ्रॉम द लिवर इज एंटरिंग द हार्ट, ऑलराइट। And then there's a systemic circulation, just all the body is giving its deoxygenated blood and it is entering the heart through the vena cava systems. All right. So the portal venous system taking blood to the heart itself, liver का blood ये carry करे, liver कह रहे भाई मुझे किसी की जरूरत नहीं, I don't need anyone, I have my own portal circulation. This systemic is like fine, I have my own life, I'll just go through the vena cava system. If the liver doesn't need help, why should I help it? All right. So they are like functioning independently. This is carrying its own blood to the heart. This is carrying its blood to the heart. Okay. What happens is there is this area where the liver veins and the systemic veins are linked up to each other, or you can say their collateral bypass routes are being formed. All right. So whenever there's going to be damage to the liver, or there's going to be any obstruction in the pathway of liver 2, that the liver is unable to get its blood to the heart, what's going to happen? These pathways will open up. These are collaterals. So these collateral pathways will open up, means they'll start dilating. All right. So this portosystemic shunt is present at the lower end of the esophagus. All right. So whenever there's going to be an issue with the liver, whenever liver is going to undergo any damage, what happens? These portosystemic shunts will open up, which is lying at the lower end of esophagus. So in the lower end of esophagus, when these open, they become dilated tortuosities known as esophageal varices, and even the slightest bit of movement causes their rupture and the person starts throwing up blood. This is my favorite part. So the person, this is what's going to happen. All right. So hematemesis is caused by esophageal varices. This was the concept. What you have to write in the exam is simple. All you have to say, esophageal varices are dilated tortuosities occurring at the lower end of esophagus when there is opening up of the portosystemic shunt that is located at the lower end of esophagus, resulting in hematemesis. That's all you have to write in this case. The concept that I had to explain was explained because इसका concept आपसे अगर if they ask you in viva, you won't be clueless and you will literally top the viva if you're able to tell this concept to them. And also in your second year, when you're going to be suffering in abdomen region, hopefully not, that's when they will elaborate upon this concept and that's when you'll be overwhelmed. So overwhelmed ना हो तो मैंने अभी पढ़ा दिया ये वाला concept. Okay.